Another big problem we see is overlap, where people use several supplements or they're using a manufactured feed and throwing in a few more supplements. The diet can still be deficient, but certainly we have cases of overlap. Excess selenium, something we see, chronic hoof problems, and it's not usually something that's considered, but if you have a look at the diet, you'd be surprised sometimes at what people are feeding. Excess vitamin A is another one. It causes bone fragility, and a lot of manufacturers are pretty keen to add vitamin A, and the synthetic form is actually predisposes the horse to more toxicity than the natural form in leaching hay. Sugar and starch levels too high, and the nutrients below recommended daily intakes. So first we're going to look at the lysine amino acids. So every tissue in the body has its own recipe of amino acids, and there's over 500 amino acids in nature, but there's 22 which are used by all living things to make cells. Excuse me. Now, of those 22, the horse can make 12 by changing them, moving around some of the elements to make different combinations, but there's 10 that they can't make, and they're called essential amino acids, and they must be provided in the diet. So when we are actually looking at the protein, what protein requirements, we're trying to meet the horse's essential amino acid requirements. So trainers, there's heaps of surveys from different countries around the world on the supplements that horse riders use. Average is 5 supplements, and some of them are up to 10. Now, we're not going to worry about the names here. This is just to show you one diet. This is what it exceeded the capacity of my analysis program. They were feeding all those things. So if we look at how do excesses occur, and these two are examples of horses that had excess selenium. The first one, the selenium was over 1,000% of recommended, and the second one pretty much the same. And it's not any particular company proprietary feed, it's the combination, because a lot of these things contain the same minerals. So horses that can benefit, certainly pregnant mares, you're probably aware they are at risk of insulin resistance at about 26, 27 weeks. Growing horses, obviously, with the developmental orthopedic diseases, and many veterinary clinical conditions such as arthritis, behavioural problems, body composition. There's a lot more information now available on the role of nutrition in colic, certainly not just the diagnosis, but the feeding management's really important, including Cushing's, dental conditions, diarrhea, endocrine, EPSM, hoof problems, even injuries. We can do a lot to help in healing of those. And for performance horses, the body composition in terms of the power to weight ratio is really important. So we see anything that doesn't have proper muscling or top line, you'd be surprised at what you can find with a diet analysis, and there's some very common findings. Obviously, muscle conditions, post-surgery, stomach ulcers, and skin conditions. Nutrition can have benefit or a role in most of those conditions.